Welcome back to the Download Show. Today we have Dr. Hunaid Gurji on the show. Dr. Hunaid Gurji is an assistant professor in pediatric hospital medicine at UT Health Houston, renowned for his innovative research and groundbreaking teaching methods. With a unique blend of expertise as both a physician and a scientist, Dr. Gurji focuses his research on pediatric critical care, exploring how metabolic therapies can revolutionize trauma and emergency care. He's also a pioneer in medical education, leveraging technology like ChatGPT and interactive digital platforms to enhance student engagement and learning outcomes. Welcome to the show, Dr. Gurji.
Zach, great to see you. Thank you.
First off, I want to ask you about utilizing technology in medical education. What have you done to date?
So early on in my career, I had, when I was an outpatient pediatrician, I was working with medical students, and, those medical students that would rotate, at least in Houston, they were at many different sites. It wasn't just one particular site, and they were all throughout the entire city of Houston. So you had to get pretty creative in how you teach them. One way you can do that is have them all come to your clinic and just have them look at a screen and do a PowerPoint presentation. But that's just one time out of the week. And so you want to be able to interact with them too. One way that I had figured out to at least interact with this new generation, because this new generation is really all about their phones and technology. So I used a program called GroupMe. GroupMe is actually nothing more than just a chat program. You can just chat with your friends, much like WhatsApp. But what it allowed me to do was it allowed me to interact with the students, and I would actually put cases in GroupMe, and then I would chat with them and ask them, okay, here's this information. What do you think is your differential diagnosis? And then they would you could see them chatting away, giving me their thoughts. And then we would it's almost like we were one big chat group. And I was just kind of leading the chat group and helping them figure out what the diagnosis was and the treatment plan and, the, what to expect in a long-term care for a patient like that. So it actually proved pretty useful, to use. That was a really nice way to kind of segue into, use of technology for that. Another program that I ended up using for the medical students was this program called Heartpedia. And Heartpedia, it was really nice. I was teaching the medical students about congenital heart lesions, and you can look at a PowerPoint, you can talk to a group of students, and they can take their notes. But a PowerPoint, at least back then, and with at least the skill set that I had back then, it's just flipping through slides, flipping through pieces of information. And, just as well as I do, right? There's only so much that you can take when it's just reading and looking at a 2D image. And so, I think it's the Cleveland Clinic, if I'm not mistaken. Let me double check. But I do think that, let me see, Heartpedia, here we go. I'm trying to find out who made it. Should give them credit. I'll find out in a little bit.
Sure. Always put that in.
Yeah. But Heartpedia was nice because the students could look at the heart three-dimensionally, and they could compare a normal heart versus the heart with the lesion, and they could look at different slices of the heart to see where the lesion is in the anatomy, and then it provided a nice a nice description about what the lesion did, both in terms of pressure and gradient and flow of the blood and also the electrical activity of the heart too. And it would tell you what surgeries were needed as well. So that was a really nice aid to just using a PowerPoint.
Now, for the last 6 months ago, you've been actually experimenting with ChatGPT for medical education. Tell us a little bit more about that work.
So, ever since you and I have been talking, I got kind of like this bug in me where I wanted to see if we could use chatbots to help teach. And there's a couple reasons why I thought chatbots might be a new innovative way to teach students. And again, because, the old, and I'd say old way of learning is, where we either, read a textbook with a pencil and paper in hand or look at a PowerPoint presentation. That is not necessarily consistent with how this new generation learns. Mm-hmm. This new generation is about, nuggets of information that are being fed. Mm-hmm. And they collate those nuggets until they build their library of information. And so I wanted to see whether we could use ChatGPT in a way to help teach students. So one of my passions actually is pediatric advanced life support, or PALS. Okay. And PALS training is how to take care of a child in an emergency setting to stabilize them in order to, provide a disposition whether they need to go to the ICU or go to some other section of the hospital. PALS training, when you get PALS trained, you usually undergo training every 2 years. So it's once every 2 years. And, for the first time, you spend about a day learning it, and then they give you a test. And then when you pass the test, that's it. You have passed your PALS training, and you can now use your information in the hospital or even in the clinic should a kid have an emergency. And you're expected to be able to utilize that information that you learned to save that child's life, right? Mm. But just as well as I do, number one, if you don't use the information, you're going to lose it. And number two, I almost look at it like a dose of medicine. Getting a dose of PALS once every 2 years, that is not enough, right? So my hypothesis was, well, what if you can have your PALS training, the official PALS training, but what if maybe we say you have some form of education through a chatbot about PALS, maybe once a quarter, because we know that research has shown that at least for mock codes or pretend codes for pediatrics, having that dosed once a quarter allows for better education retention. So maybe what we do is we utilize that research and we do these chatbots maybe once a quarter. And that would help the student or the resident or even the attending kind of keep that information, closer in the front burner as opposed to the back burner, right? Mm-hmm. So I've been working on that. It has been challenging, as you and I have both learned.
What are some of those challenges that you've seen?
With any type of large language model, one of the things that you learn about is hallucinations. Okay. And, a hallucination, for those who don't know, is basically when the large language model or like something like ChatGPT, or Copilot or whatever model you're using, if it doesn't know what the answer is, it will probably make up an answer. Okay, it'll utilize some form of resources to come up with some variable answer, but that answer may not necessarily be correct. So one of the challenges was how do I mitigate the hallucination that ChatGPT undergoes when it doesn't know the information? And that was, that's a big problem, because of course when it comes to medical education, you cannot receive false information, because then it's basically garbage in and garbage out. right? You need to, it has to be solid information that comes in. And so that, making sure that ChatGPT was not going to hallucinate, that was a tricky process. Number two was trying to actually get the information uploaded to ChatGPT. I've learned as I've gone through this process that, there's so many uploads that one custom GPT can have, which is 20, by the way. There are so many characters that you can put in a string that you, as a prompt for ChatGPT. There are little switches in the custom GPT section that you can toggle on or off that help you customize that GPT. You also need to be able to, teach that model, right? And just because you think you have your prompt as perfect as you'd like it to be, like you thought you've engineered it properly, when you run it and you actually play with it, it doesn't do everything correctly. So you have to go through the motions of, almost like teaching your model what to do. An example of that is, in my custom GPT, I tell it, hey, I want you to prompt the user after you've given them all this information, what would their differential diagnosis be? And at first, it would ask you and you would give your differential diagnosis. And if it was wrong, it just give you all the answers right away, immediately. It'd say, nice try, and here's all the answers. Obviously, that's not the way to do it. So I'd have to tell it, hey, I want you to give the user 3 chances. And I would type that into the prompt, but that was not necessarily occurring when I would run the GPT. Mm-hmm. So you have to tell it, hey, while you're playing with the GPT, you have to tell it, if it didn't give you the 3 tries, hey, you were supposed to give me 3 tries, and it'll say, oh yes, I'm so sorry, I'll remember that for next time. So it's learning. And so, just as much as I've had to troubleshoot how to upload information, like which types of documents are very useful for uploads, Excel spreadsheets versus PDFs versus Word documents, how to toggle on and off those switches to ensure that it doesn't hallucinate or at least mitigate the hallucination. And then, of course, playing with that model and letting it learn, those have been the biggest, I would say, obstacles to getting it right.
What do you think about broader kind of ethical consideration with your students using ChatGPT, AI like ChatGPT? Do they state or, that they use ChatGPT, or do you want them to state what they use it for and how they use it? And, do you think about over-reliance of your students using AI as well?
Yes, I do think about it. There was a recent article that said that, and I think it's probably about a month ago, but said that basically I'm paraphrasing what the whole article was about, was the constant use of AI in our daily lives is almost making us less smart, less creative. And so, if I'm using ChatGPT and I say, these are my symptoms, what differential diagnoses are these symptoms? Okay, it's okay to do that from time to time, but you also have to build your knowledge base up here too, because you're not, you can't stand in front of a patient who's not doing well and they're having fever, cough, and difficulty breathing, and just stand there in front of your phone doing this. You can't do that. You're not going to have access to AI, at least not in the near future. You're not going to have access to AI that quickly. It could be baked into the electronic medical record, which will then say, like, hey, warning, your kid may have pneumonia or sepsis, which will probably happen, to be honest with you. There will probably be some AI baked into it to help you make those decisions. But honestly, when you run into a room and the kid is there, you're not necessarily pulling a computer with you too. You're there facing the patient. So you need to build your knowledge base. With that being said, it is still important to make certain that you understand what, how to build a differential diagnosis up here, and then once you've stabilized that patient and you feel like you need to refine that differential because you want to make sure you're not missing something, or the patient is not necessarily reacting to the medications or to your interventions as you thought, yeah, I think it's appropriate to use AI then, But if you are heavily relying on AI every day to help you with your medical decision making, I do not think that is correct. Because the medical decision making needs to come up here, and then you can verify it or refine it with AI. And so I do worry a lot about medical students using AI too frequently. Okay. Now, do I expect them to tell me when they've used AI? No. Because at the end of the day, I need to know that they're thinking about things, right? So when we're on rounds, I'm not going to say, "Hey, did you look this up on ChatGPT? Is that how you knew the right answer?" Okay, not really. I'm not going to do that. But I can also tell, right? You can tell when someone has just kind of glossed the surface of something. So sure, maybe they did get the differential diagnosis from ChatGPT, and maybe they want to talk to you about sepsis. But then you can now, because I've learned these topics through studying, I know how to dig in deeper through sepsis and what labs I want to order and what am I expecting those labs to show. So if you're just glossing the surface with ChatGPT and you just know the word sepsis, but you don't know anything else about it, it's going to be evident during rounds for sure. So, while it's okay, we shouldn't shy away from using AI. AI is here. It is not going away. It will be integrated into everyone's lives. What you have to understand is, how do you use it responsibly?
How do you think, and then how do you think about responsibility, but how do you think about, taking that point, how do you think about training people to be responsible? And you kind of essentially insinuate that the only way for people to learn how to use it responsibly is to use it a lot, and then they realize, and I guess all parties realize what is responsible use.
Right. So, you can use ChatGPT to help you study. There's nothing wrong with that. In fact, I'm sure lots of people use ChatGPT to help them make notes, help them understand principles that may have not been, written very clearly in the textbook, right? So I am not opposed to anyone using ChatGPT to study. What I'm saying is, if you're walking into work every day as a professional, right? Not as a student, but as a professional, and you're heavily relying on AI to help you make diagnoses that you should be able to make without the aid of like a textbook or a crutch, because you understand the pathophysiology in your head. If you can't do that without AI, then you haven't learned the material. So again, I'm perfectly fine with you meaning the general public, perfectly fine with you using AI to help you study. But at the end of the day, you need to be able to walk into a room, look at that kid, and know exactly what you need to do very quickly.
How do you think, what percentage of actually medical professionals and professors like yourself utilize AI currently, and do you think that percentage is actually only going to increase in the future?
That's a good question. I do not know the exact percentage, but I can tell you that I can give you an example. Okay. ChatGPT has been around for some time now. Okay. AI has been around for some time. Okay. Last year, I went to a conference and I made a lot of friends, and we gave a very nice presentation. While we were there, an individual gave us a talk on AI and the use of basically like ChatGPT and some other AI websites to help with mental education and kind of like help us with our administrative tasks. And so we had a group of about 8 people, and I was the only one at that time that had taken an actual formal class in AI in medicine. Okay. And then of that group, I would say 1 or 2 decided to start using like ChatGPT as a method to help them with their administrative tasks. Skip forward an entire year. Okay. I would say now there's about 5 individuals that are starting to use it. Okay. So to answer your question, people are slowly learning the power of AI. And I think what they're learning is that AI can help them with a lot of administrative tasks. It can help them get over that creative hurdle, right? So, needing to write letters of recommendation, needing to write, helping start a lecture, right? Or creating a syllabus. There's a certain level of, it's almost like I kind of look at it as like potential energy. Like you need to get over this hump before you actually start really kind of getting your ideas and putting them on the computer. And I think that's what AI allows you to do. It really lowers that threshold. It gives you a starting platform, and then you're like, okay, I can see that this is helping me be far more productive. Instead of it taking me 2 hours to help, to make this outline, I just got this outline in 10 seconds. This is a pretty good outline. It's not everything, but it's pretty good. So I think a lot of people are seeing how it'll help them in administrative work for sure, because doctors do a lot of administrative work as well. Okay. And that eats up a lot of our time. And sometimes it eats up so much time that it actually starts to erode a lot of patient care time. And so it's really important that we try to kind of give back some of that administrative bandwidth. And that's what AI has helped us do.
Well, thank you very much, Dr. Gurji, for your time and coming on to the show.
Thanks, Tak. It was really nice to be on here. I appreciate it.